All right. Well, it looks like we are recording, Dr. Baird, so I'll go
You
ahead
bet.
and kick us off. Good evening, everybody. Stephen and Contrara with Compassionate Finance. Welcome to episode 16 of Outstanding Balance. This is your every other Monday webinar where we discuss a variety of topics from around the dental industry. This is, of course, brought to you by Compassionate Finance and Abella. Tonight we have Dr. Baird, and we're going to talk about practice value. Really a great episode he did on his Productive Dentist podcast a few months back, and I think you'll get a lot of insight kind of from what he means of what practice value truly is and how much your practice is really worth. So do go ahead and put those questions in the chat. And without further ado, Dr. Bruce Baird.
Thanks, Stephen. Appreciate it. Yeah, the topic of practice valuation is one that is, it's pretty wide open actually, because you hear people, and I'm going to talk from both sides of the fence, from a dentist looking to buy, what should you be looking at, and as a dentist looking to sell, what should they be looking at, and they're similar. But I think, if you're wanting to buy a practice, there are certain things that you want to look for, and or it can adjust the cost of that practice. So, but what I have to tell you first is my story, and many of you have heard it, but when I opened Granbury Dental Center here in Granbury, Texas, 35 years ago, I had come out of the military and I was making $28,000 a year as a captain. And I got into private practice in Granbury. And in our first year, we did $1 million in production. And that year I took home 32,000. So I had an overhead, if you can figure that, of 96.8%. We did $1 million doing $240 crowns. So we saw massive numbers of new patients and we did all kinds of marketing, but I was somebody who burned out in dentistry in a matter of about 3 years in private practice. And it was something that I wanted to be a dentist from the time I was a kid, 8 years old. And so I really, at that point, had to step back and say, okay, what kind of practice do I want to have? And so I'm going to talk first about a seller, and it doesn't matter whether you are selling at 40 years old or 65, you really have the same things to look at. Number one is the only way that you can increase the value of your business is by increasing your productivity or increasing your profitability. So those are two different animals. Increasing productivity, what it does, and we've talked about it in past webinars, and it's what we teach at Productive Dentist Academy. If you're at, let's just say you're above national average, you're at $500 or $600 an hour, and you're thinking, I want to be able to sell this practice, and $600 an hour is, you're doing 900,000, almost $1 million. And you think to yourself, I want to sell this practice, and you're starting to plan ahead in 5 years. What are the things you could do now to actually increase the value of that practice? Well, first of all, you're going to stop going to all the dental meetings, which they've kind of quit, because every time I went to a dental meeting, I bought some new crap that I had to put in the office and try to figure out how to use. And you really don't need every new latest bell and whistle. You want to be up to date, but you don't have to have everything. I would say a CBT is something that is necessary now in dentistry. We got the first one in Texas, I think, as far as a dental practice back maybe 18 years ago. And we use it all the time. But what you're going to do is you're going to be focusing on increasing your productivity per hour, which will affect, and there's no question, in a matter of 2 years, you could literally double your productivity. Now, when I say that, you could easily go from 900,000 to $1.5 million, $1.8 million with hygiene. And now what you've done is you've grown your business. And we talk about investment grade businesses, because that's what's happening nowadays. People, whether it be DSOs, and we'll talk about DSOs, or individuals, they want to see an investment grade business, one that has, that has a great team, great communication, a great service mix. If I'm buying a practice, I love seeing that. If I do the kind of dentistry that the dentist who is, in that practice if I'm looking to buy that practice, I want to know that I have the skills to be able to follow through with what they've been doing. More often than not, uh, it's a buying doctor that comes in, and what I love to look at is, well, how many, is the dentist that's there now, are they doing comprehensive exams? Are they just doing one tooth at a time? And we'll talk a little bit more about that. But if I'm growing my business, I also want, what that does is it drives your overhead down. It drives your fixed expenses down. Therefore, it increases your productivity. So you control spending. We've talked about that in our forward, in our analytics conversations that we talk about on the podcast. Predictive analytics. I want to know exactly what we're doing next month. And how do I do that? If I'm buying into a practice that knows what they're doing every month, and the team is motivated, and the team understands the systems that it takes to run a dental business, then I would be very interested in buying into a practice like that, because then I could come in. And I used to think that I was absolutely indispensable in our office. And this is kind of hurts my feelings, but the truth is I wasn't. I mean, I was the lead producer in that practice for 35 years. And when I stepped away from the handpiece, guess what? We had built a team. We had built an investment grade business that was so good. My partner, Dr. Buski, and two associates now are producing, coming close to what we were producing when it was just he and I. So I think this investment grade conversation is important to have. And knowing what you're doing on a day-to-day basis is absolutely critical. So if I'm stepping back and I'm thinking to myself, okay, I want to increase my business so that in 5 years when I sell my practice, I can get a better price. I can get a higher, my EBITDA goes up, earnings before taxes and depreciation. That will go up. But today what I'm noticing is people are buying dental practices, not even, in some cases, not even following EBITDA, just looking at a percentage of previous year's collections. For a while, that was 75%, 80% for some, previous year's collections or previous 2 years' collections. That started to go down as the DSO market came to play. That went from 80 to 75 to 70 to 65 to 60. So those numbers were dropping. So what would I do if I was wanting to sell my practice? First of all, let's talk about the DSO market. The days of selling to a DSO and walking away, I think, are pretty limited. I don't think we're going to see that as much anymore because the DSO market is growing. They need dentists, and they need dentists to stay in that practice for a period of 2 years to 4 years, and every DSO is different. And they're paying anywhere from, they look at EBITDA most often, and they're paying anywhere from 2.5 to 3.5. If you've got a really well-run office, it might even be up to 5 times your EBITDA. So if you're netting in your practice 400,000 or 500,000 a year, your practice may be worth somewhere around $1.5 to $2 million. Now, let's step back, and because why would I sell to a DSO? Which I did sell to a DSO. I sold to Heartland Dental. And was I glad I did it? I was 55 at the time. It made sense. I was a little afraid of Obamacare, to be honest, and that I was going to have to provide all these benefits for my employees. And I had 23 employees. So the time was right for me. However, there are things you have to think about. Okay, if I'm going to sell to a DSO and they're going to pay me 25% of what I do, how much money am I getting up front? So they give me a bunch of money. And I divided that out and figured that they were prepaying me for 13 years of dentistry. And I could go into the practice and still work and spend, not have a lot of administrative duties. But remember, our practice was really hitting on all cylinders. So I really didn't have to do very much management as far as that was concerned. And I looked at 13 years, then I looked at 25% of production or collections. And, that was a pretty big discount for me working there. So I was making before that, I was making probably 800,000 a year in my practice, maybe more. And that dropped down into the around a half a million a year on 25%. So was that good or bad? Well, I just realized that you just have to realize that if you're thinking about doing it, look at all the things. Look at how much longer you want to practice. Look at all these things. I'm seeing a lot more younger dentists selling their practices. If I had productive years ahead, I probably wouldn't do that. I'd rather keep my business going and build an investment grade business so that dentists would be able to come in and be productive right off the bat. My valuation of my practice at that time it would be sky high, which ours was sky high. We were much closer to, we were much higher. Now, what about the dentist who's looking to buy a practice? Different conversation. What do I want to see? If I was going in to look at a practice now, what would I look for? I would look for, first of all, I'd look at the production collection numbers. I would go through the charts. I would look and see and say, a lot of single tooth dentistry, possibly a lot of, one at a time crowns, a lot of that type stuff. You might think that's a disadvantage, but it could be an advantage. If you really work on your verbal skills and you work on the things that allow you to sit comfortably and talk to patients and do comprehensive exams, all of a sudden, where that previous dentist might have been doing the national average of $400 an hour, $425, I could walk in with all of these patients that need dentistry as long as I'm comfortable sitting in front of them and going through an explanation process and getting them to buy in to what it is that I'm recommending. And when I say recommending, what we do at PDA and we look at this and we teach how to get in a relationship with patients so that you're very comfortable telling a patient that they need to have X amount of dentistry. It's A-okay. You're not going to be afraid to talk to people. Remember, 95 out of 100 crowns are done one at a time because of insurance. And I hate insurance. You guys all know that. I will do anything to do any procedures that don't have anything to do with insurance. That's my favorite. But if I'm looking at a practice and I say, okay, this practice has a lot of pent-up demand or pent-up need, then I can buy this practice at a discount and I can grow it. That's one way of looking. Another way of looking is coming into a practice to buy and say, I'm bringing an enormous amount of skills. Dixie, you've got a lot of skills you're bringing into the practice. That's awesome. And so you look at this and you say, I can grow this business and that business value will be much higher. Now, are you going to sell now? No. What you want to do is continue to grow this investment grade business, this investment grade practice, so that at some point, when you do decide to transition into another situation or whatever, you're going to be at top value. You're not going to be at low value. I see a lot of dentists, they work, and that's okay. If you've got a whole buttload of money and you're not worried about money, back in the old days, dentists just used to lock their door and say goodbye. They pulled a shingle up and they said, go somewhere and go see my friend down the street. They sent a letter. They didn't even sell their practices. What I will tell you, and Stephen has seen this, I know Herbie's seen this with compassionate finance. I mean, we've had doctors that have had almost $1 million in debt paper that they had been helping patients over a period of 3, 4, 5 years, and they took that paper with them. So they were being paid monthly revenue even after they sold their practice for X amount of dollars. So there's lots of ways that you can look at that. Now, if I was a practitioner coming in to buy a practice, I would be looking for that type of practice that either I could boost because I do different procedures than what was already being done, or there's so much pent-up demand that I can grow that business from an $800,000 practice to a $2 million, $2.5, $3 million practice. Granbury Dental Center, I work 2 days a week. Jeff Buski, my partner, worked 3 days a week. And we had one associate that worked 4 days. Usually the associates were producing about $350 an hour. But we had 5 hygienists. We were doing 5.5 to 6 million a year. So we drove our overheads way down because we outproduced our overhead. And those are the things that you have to look at. So these are a lot of topics. There's a lot of things. And Stephen, I know, we're into, our 15-minute time, but I want to answer some questions for people if we have any.
Absolutely. We don't have any questions that have come in just yet, but I want to acknowledge what Deb said over in the chat. If you're not in the chat, you should take a look at this. She says, my husband is 76 and he still wants to work. Since COVID, we have been busier than ever with our orthodontic practice due to supposedly people working from home. And they're coming in for braces. That's right, Deb. They've been looking at their mugs for the past 9 months and they're seeing something here and something there. And more patients want this. I've heard that like treatments like short-term orthodontics in the last 5 years with things like Smile Direct Club and those at-home aligners, they've driven not necessarily the types of cases that get done properly, but awareness of short-term orthodontics is up in Google searches 500%. So
Yeah. Well, the interesting thing is, Invisalign stock, it is now the most valuable dental company in history of dentistry. Why? Well, because pent-up demand, and I do think Zoom gets you looking at your teeth and you're going, I got to do something about that. So, I mean, that certainly plays a role. But everybody, I used to talk about associates, and I was teaching at Baylor at the dental school, and I would tell the associates, here's the deal. You can go in and you're going to get paid 35% of collections, or you're going to go in and you're going to get paid 25% of collections. Which one do you want? And of course, they would all say, well, I want 35%. I said, okay, well, let's step back. 35, what if it's 35% and you have to grow your own business? You have to go out and, knock on doors and do the things that you have to do in the community to grow your business at 35%. You're not getting any new patients unless you drive them in. And a lot of times those dentists aren't even marketing much. Or you go into a practice that uses compassionate finance, you're getting 25% or 30%. And now you're getting to see marketed patients, ones that come in the door. In other words, it all has to do with new patient flow. And that's one thing that I always look at. Is there a healthy new patient flow in the practice? Whether I'm building an investment grade business or whether I'm looking to buy a dental practice, I want to know that there's healthy new patient flow. Now, the flip side of that is, what if there's not much new patient flow, but it's in a great area, great clientele around, dentist has been underproducing? Well, that's another different way of looking. That's a different way of thinking. I can come in here. Yes, I might need a little upgrade of some new equipment or those types of things, but I can actually take this thing from where it is at 800 grand a year, and I can turn this into a great business, $2-3 million business. And that's not uncommon, and going through and using compassionate finance and going that route, you're going to be able to help a lot more patients. But also on the flip side, learning to be able to build a business where your team is so well trained, where your practice is running on full gas. I mean, you're just cranking. Now, when somebody comes in, you want to sell that practice. To me, I'd love to come into a practice like that because I know the patients are there, and then it just comes down to good communication skills. So those are my thoughts on that part of it.
It's wonderful. And James kind of had a comment after EBITDA. I think that's such a hot thing to ask about. So you talked about percentage of prior year revenue. Can you talk about multiples of EBITDA?
Yeah, I mean, if you have, the big deal right now is to go open up multiple practices, and the EBITDA changes. So if you have a single practice, you can look at EBITDA. You might get 2.5 to 3.5 times. And again, if it's an investment grade business, you could get 4.5 to 5, even higher. If your business is running on full speed, so that's using EBITDA as a guide. I use the other, which is kind of an average. That's what DSOs a lot of times will look at, although they'll make the offers based on your EBITDA. They look at, okay, to give you just a ballpark figure, maybe 65% of previous year's collections. If you're just wondering, what's my business worth? If you're doing $1 million, worth 650. If you're doing 2 million, might be worth 1.3. And those are just kind of off the cuff remarks. But EBITDA, by driving productivity up, inherently that drives overhead down, any fixed expenses you have. But it's also time to look at, what are you spending on supplies? What are you spending on? Every penny you can squeeze out becomes part of the purchase price. And so that's the way I look at it. Now, I've always looked at all of the expenses. I've always looked at all those things. And it was because we weren't making any money. So everything was about expenses. But once I realized we were seeing plenty of new patients, and I got better at my communication skills, which is probably 10 years into practice. And I started studying communication skills and studying those things about how to build relationships. Changed everything. And, our practice grew exponentially once we did that.
All right, so we have two kind of questions that came in. I don't know if you see that top one from Herb.
Let's see. What does it say?
It says, what to ask. For now, she can say she is growing at all. With a little marketing, she will do more. I cut a $50,000 tomorrow. Pay Dixie $2,000 to assist.
She's got it down. So she's got it down. Yeah, but it seems group practices are setting at 8. Oh yeah, okay, I see that. I appreciate your comments, but it seems group practices are selling at 8 to 14 times EBITDA. No, I totally agree. Why is that? That's a great question, James, because what's happening is when you take revenue from not one business, but 2 business, 3 business, 4 business, 5 businesses. And let's just look at, if I'm a DSO and I want to go out and buy 5, let's say 10 practices, and I'm going to pay 5x EBITDA. The higher the volume, the higher the revenue that's coming in, the higher the multiple. So these multiples, multiples today, I've actually seen multiples as high as 16x, but it's not for a single practice, unless it's got like 8 specialists, and that's a different animal. 8 specialists in one group, yes, you could get a much higher multiple because their revenue is 20 million a year. It's not, it's not 800,000 or $1.2 million. So when that DSO buys you, they know for a fact they're going to buy you at 5x and be able to sell in 5, 8, 10 years at 14x. That's how they make their money. And that's really, it's interesting. Some of the DSOs out there are just basically buying revenue. That's what they're doing. They've got a banker that wants to get in the dental space, and they're spending money. Heartland was bought by KKR, and they've got 300 million to buy more practices. I think it was somewhere like that. And I mean, they're buying practices and starting de novo starts. Why? Because they know the more revenue, the higher the multiples. And that's why they do that. But there's no question, if you are a group practice, your multiple is going to be very different. Now, I will tell you, you can make really good money in a single solo practice. You can make $1 million a year in a solo practice. I've had multiple practices. It's not easy. Some people are phenomenal business people. One thing that I have noticed a lot is guys with average practices, average, are going out and buying they might have some cash or availability of cash, and they're going out and buying multiple other offices. And those DSOs are becoming average DSOs. They have high collection rates. They have high overhead. They have high, AR. And we're working with Abella, just helping them reduce their overhead of what people owe them, because they don't have the systems in place. So if I was going to start a DSO, I would use all the systems that we use, and I would make sure that every single office, I evaluated them for their systems and what they were doing. I don't know if that answers that question, but that's the thought process.
And Dr. Baird, that reminds me of some conversations we've had with Dr. Paul Goodman too, about like that little bit of AR that's hanging on out there that nobody can figure out what to do with. And, you let $15,000, $20,000 worth of recovered AR get in the way of some of these bigger deals sometimes. using something like Abella to kind of clean up your AR, either if you are purchasing a practice or selling a practice, it's a great way to do it. 30% of patients pay the first time they're contacted through our Abella system. So cheap plug there, but I would love to give you a 30-day trial. It integrates with 90% of dental software. So go ahead and click that link in the chat. You don't have anything to lose there. We've had folks recover multiple thousands of dollars in the matter of weeks on these trials. So it is definitely worth your while.
Yeah, we saw, I mean, in our practice, and I think we have pretty dang good systems, but it's stacked up. We're doing, like I say, 4 million, 5 million a year, but it's stacked up on us. And the over 90, we picked up 77,000 in 27 days. And I was like, really? You calculated that was like a free 77 grand. So that was pretty darn exciting. Let's see what else we got down here.
Absolutely. Yeah. If you have any more comments or questions.
All right, guys. Well, we will have another one here in a couple of weeks. You can go to our YouTube channel and go back and look at some of the others we've done. And again, if you have any questions, you can always send it Bruce@productivedentist.com. I'll do a webinar on just questions. I do podcasts on that all the time. So just want to try to give you a different way of thinking. And I think that's important, especially we're in a different time now. And there's going to be different ways that you're going to run your business to become more efficient and more effective. And that's the game. That's the game. So, all right, guys, thank you for being on. And I will see you in a couple of weeks.
You bet. March 15th, the next show, you will have a recording of tonight's presentation in your inbox tomorrow morning with
March 15th. We may have to do it. We may have to do it. I'm going to be at Bellagio in Vegas. Can we do that the 22nd?
Oh, I'd love to see you record a webinar from a blackjack table. I think everybody would like to see it.
Let me tell you, I'm playing golf that day in a tournament, and we might want to do the day, the week after that. Well, we can adapt. We're easily adaptable. So
you bet.
I don't think anybody wants to hear me they might do a podcast after having cocktails on the golf course all day. So we'll have fun. All right, guys, see you soon.
Thank you.
Thanks.